This is lab 18 on the dog specimen. So today, at least personally, I feel like this is a really challenging lab, so try and be patient and keep working at it. And we're doing the abdominal aorta and doing a lot of vessels today that are somewhat difficult to dissect, and I'm hoping this comes out on the video and that it turns out okay. So we'll give it a shot. Here we have the diaphragm, so here would be chest, the thorax here, and now we're in the abdomen down here. So the diaphragm has been reflected. If you haven't done that, it might be helpful to cut that and reflect it. And you're looking to follow the descending aorta, so down into the abdomen here. You have several of these lumbar arteries, so those are paired. You can see them coming off here, and there's several pairs. Here's some more down here. And you just want to make sure and see at least a pair of those somewhere along the aorta. So those are lumbar arteries. Now we're going into that celiac plexus and the cranial mesenteric plexus, and we're going to look for arteries coming out kind of underneath those. So using your little scissors, you want to bluntly dissect and find where these arteries are beginning. So this one is celiac right here. So the celiac artery, obviously underneath the celiac ganglion and plexus here. So you just kind of have to pull it away. Pull the nerves away, but don't cut them unless you absolutely have to. And then you'll have your celiac artery here, and that will give off 3 different branches. So here, if I hold this stuff out of the way, hopefully we can see. Here would be left gastric. This one is going to be splenic. So here I have the spleen up here. You can see that's going up towards the spleen, so that will be splenic. And then the hardest one to find, I think, of these 3 is going to be the hepatic. And so that one actually dives deeper. So it's way down in here, and you have to kind of dig for it. And that will be hepatic going up towards the liver, and it kind of dives deep to the stomach there. Okay, so the left gastric, we're going to follow that around to the stomach. So you're going into the lesser curvature of the stomach. So here, the stomach is a quadrant supply, so here you would have a left side, a right side, and then you're also cutting it into another plane here, so you have like cranial and caudal, but these could also be the lesser curvature and the greater curvature quadrants. So you have kind of those 4 quadrants. On the lesser curvature quadrant, you'll have the left gastric and the right gastric arteries, so one from each side. Then on the greater curvature quadrant, you'll have the left gastroepiploic and the right gastroepiploic arteries. So those are on the greater curvature. So that's the difference in the naming. So here we have left gastric, and that one will actually come around and pop out right here and kind of come out right there and curve around here on the left side. So that is left gastric artery. All right, then we'll flip the stomach back over here. So that was this one, left gastric. Then we have splenic, going up to the spleen. So you have splenic here, going up. Then splenic will give off the left gastroepiploic. So here you can see that branch coming out here. That's part of the splenic. And this will actually be the gastroepiploic. And that goes here, you can see it curving around, and another piece curving here, going to the greater curvature of the stomach. So that would be left gastroepiploic artery. Okay, now to the hepatic. So hepatic is a tough one, and usually I tell people to look for it here, and then kind of put your forceps around it like that. And then you're going to flip the stomach down, look in the lesser curvature here, and you'll have to tear your lesser omentum, and you're looking for it. You're looking for your forceps is really what you're looking for, and then moving the tissue away to find that artery coming out between your forceps there. So that's a little trick that I like to use. So here's hepatic. You can see it following along here with the probe. So then I'll take out my forceps. Now you tilt the liver cranially, and you're looking for branches coming off the hepatic. So here hepatic. Here you have hepatic branches coming off. You'll also have a cystic branch coming off going to the gallbladder that you don't need to find, but just know that there will be a bunch of branches right there. So then you're looking for a right gastric, and then you'll have the gastroduodenal. So here This often happens, so don't feel bad because I do it too. This is a broken right gastric artery. So this goes to the right side in the lesser curvature, so it was right here, and it just gets ripped as you're digging around in there. So right gastric artery. Then this, after this right gastric comes off, this would be gastroduodenal here. So gastroduodenal artery. Then you're trying to kind of dig out and find where that branch is. So then you'll have two branches. One will curve around underneath here, right here, and be your right gastroepiploic that runs along the greater curvature on the right side. So here, if you do your forceps trick, you can kind of do that and pull on it from that side. So here my forceps were on this one. So that is your right gastroepiploic artery. Then that leaves this other artery as your cranial pancreatico-duodenal artery. And so that's going to go and feed down to the descending duodenum, which is right here. So descending duodenum and the pancreas, which is kind of the stuff that I've kind of torn apart to get at it. So let's see if I can see a little piece I've uncovered here is the continuation. So here you have cranial pancreatico-duodenal, and it continues down along here underneath the pancreas. So you just kind of have to push some of that tissue out of the way. So cranial pancreatico-duodenal. All right, that is the end of the hepatic artery. Now we go back and we find the cranial mesenteric artery. So this was celiac artery here. The next one is cranial mesenteric. So again, you kind of have to push those nerves out of the way. And this one is the cranial mesenteric artery. So then cranial mesenteric, you kind of have to pull some of that mesentery apart and look for branches coming off of there. So the first part we're actually going to look at is this one right here. In the dog, there's a common trunk, but in the cat, typically not. So we're going to flip this over, and you kind of have to lay out your colon to do this. So we'll just kind of push things around. Here's your colon. So here would be the left colic flexure here, descending colon, transverse colon. So we're looking at this branch coming off of cranial mesenteric. So cranial mesenteric is right here, the big one. We have this common trunk, and then off of that we'll have a middle colic artery right here. And that kind of splits off and goes around that descending portion here, the left colic flexure and the descending colon. So here is middle colic. Then this one will be the right colic. And so that goes basically to the transverse portion here. Oh, I'm sorry, not all of that, just this part is the right colic. So in the dog, again, there's that common trunk that's going to give off three pieces. So here's the middle colic. Then this part going to the transverse portion is right colic. And then the continuation is the ileocolic. So the ileocolic then gives off three small, tiny branches. And they're going to go kind of to the cecum, the ileum, and the ascending portion of the colon. So ileocolic here, there is a figure 4-32 in your book that's helpful for this particular area. So here, the ileocolic gives off a colic branch to that ascending colon, and then it will give off a mesenteric ileal branch. So that's this stuff right here and here. Mesenteric ileal going to the mesentery side of the ileum. And then you have this other one diving deep here that I'll pull up. And that one is going to be the cecal branch. So cecal branch kind of dives underneath. And if you flip your cecum over, which is in the forceps, so flip that over, you can see that that comes out right there. And your cecal branch will continue along here. And then we'll give off that antimesenteric ileal branch that runs along the antimesenteric side of the ileum. So that's right there. Okay, then another piece off of the cranial mesenteric artery that we need to find. If I pick this up, maybe we can see where it's coming off. Oops. So here is what we're looking for. This one is tough to find right here at this point, but cranial mesenteric is here, and it comes off after your common trunk in the dog, and it's called the caudal pancreatico-duodenal artery. And so I find the easiest way to find this one, I'm going to put my forceps around it, right there, just so you can see how this works, and then flip all of this over and keep going till you're back at your duodenum. And you're looking for something going to that descending portion of the duodenum, and I usually look for it here and then follow it backwards. So here would be that caudal pancreaticoduodenal. And there you can see my forceps are surrounding that artery. So that's the same one we saw coming off of that cranial mesenteric. So that was the caudal pancreaticoduodenal artery. Okay, we'll flip all this back over. And then we have, off of the cranial mesenteric, we have all of these jejunal arteries. So all of those that you see kind of cascading down along there are all jejunal arteries. Then at the very last distal terminal portion here, we have the ileal arteries. And so they lost their injection at this point. But here I have ileum, here. And so these kind of coming down here that lose their injection, these are all going to be ileal arteries. And that's the termination of that cranial mesenteric artery. Okay. Now we have a couple of other arteries to do. So if you flip everything over, we're going to do this all from the left side again. Some of these I'll tell you though that are paired. So this is one of them. This common trunk right here coming off is the phrenico-abdominal artery, and that is a paired artery, so that comes off on both sides. So you have a left and a right, and that will give off your caudal phrenic artery, and then your cranial abdominal artery here going out to the body wall. So those are paired, so you have this happening on both sides. Okay, and then you also have renal arteries, which in this dog is kind of interesting because I do have two going to the left kidney right here. So we actually have two renal arteries going to one kidney, and then the other renal artery will be going to the other side. So you can kind of see it right here going off to the right side. So that would be the right renal artery. But on this side we have two for the left, so renal arteries, both of those. And we'll kind of push that up out of the way. And we'll continue caudally here. So you just keep following the aorta down. Again, we have some of those lumbar. You can see more lumbar arteries here. And you're looking for a really little artery. So in this animal, it's a female. So this right here, this little tiny thing, is an ovarian artery. And so here I've kind of flipped it so you can see it's heading towards this ovary right here in my hand. So ovarian artery right here, and it kind of loses its injection here, but it comes off right here. So pretty small. In the male it would be testicular artery, but in the female it's ovarian. And you do have that on both sides. So there's a right and a left. Okay, and then we have caudal mesenteric artery. So you're moving caudally, and this one is not paired. This one is single, just one. So we found our caudal mesenteric ganglion before, and that is kind of wrapping around this caudal mesenteric artery. So right here, in the forceps is the caudal mesenteric artery. Now the caudal mesenteric is going to the colon again. So if we kind of, this one is a little bit hard to see, and I have to push all the organs up here. And so the caudal mesenteric then will break into here. Now you can see a little piece of it here. So caudal mesenteric coming down, and then it will split into the left colic, which if I can, that's this one right here, coming up the descending colon. So left colic branch, and so it branches way down where the probe is. So my probe is actually in the crux of that. So left colic is coming up, and then you see that cranial rectal way down in there where the forceps are now is actually going to be the cranial rectal going towards the rectum. All right, and then we have the deep circumflex iliac, and you just kind of push everything over again. Deep circumflex iliac is another paired vessel. So here on the left side we have deep circumflex iliac coming off this way, And you can see the one going to the right side as well, right here. So deep circumflex iliac artery there and there. And then we have the portal vein system to do here. So this one, the portal vein tends to rip apart quite easily and is a little bit difficult to see. So you kind of have to push everything over to the left is the best way to look at it. Way up by the liver will be the portal vein. So way, if I can get, it would be way up there. Here we go. So portal vein is going to be here. And emptying into that, you have several pieces that we're supposed to find, these veins. So here, we would have gastroduodenal. So these are a little bit difficult. So gastroduodenal will be dumping in somewhere, one of these two. It's a little bit hard to follow because it rips apart when you try and do that. And then you're looking for a splenic vein. So that's going to be this big one here. And splenic has that left gastric here that goes to the lesser curvature on the left side, but this is all splenic. And then here you would have, if I can pull this open, there we go. Here you have the cranial mesenteric vein, and then the caudal mesenteric is the other side of that, so it would be this one right here. So caudal mesenteric vein and the cranial mesenteric vein, and all of those are contributing to the portal vein. Okay, the last portion of this lab is cutting open the pelvis. So this dog has already been cut open, but we'll just kind of push it back together here. And so you're finding the midline, the pelvic symphysis. So I took out some of my adductor muscle here to find that ridge where the pelvic symphysis is. So you want to do that. And then you kind of want to make a cut, just a superficial sort of cut on the cranial and caudal aspects of that, just to open that up so you'll be able to cut in there. And then you're also going to cut around on the cranial side. So you're just cutting your muscles as you go around the wing of the ilium here. So just cutting those muscular attachments away so that you'll be able to open the pelvis. And then again, you take these snips that you have, and you're starting, I always start caudally, I find it's easier, but you just want to get the tip in there and then snip on that midline and then kind of continue pushing it up and through and cutting the symphysis as you go. And then it will kind of cut open and break like that. And then you want to move it over to the edge of your table. And basically what you want to do is just kind of take the pelvis in your hand like this and use your right hand, if you're right-handed, if you're facing this way, and push down on the edge of the table, and that will open this pelvic area for you to see. So it takes a little bit of force, and you have to kind of be aggressive, but push that open, and then you'll see in this pelvic cavity here. So this is all fat. You can just reflect that. So then we have the levator ani muscle that's very plain here. This is all levator ani. And then the coccygeus muscle, which is not quite as plain, but right here would be coccygeus muscle. And those two together from both sides, so left side this happens and right side this happens. You have coccygeus muscle and levator ani muscle. Together, all of those make up the pelvic diaphragm. So then you want to reflect your levator ani to view underneath, and you'll see kind of this mess of nerves and vessels. And the nerves actually are the pelvic plexus. So this whole area is going to be the pelvic plexus. And if you want to follow your hypogastric nerve that we found previously, it kind of comes through here like that. So you can kind of follow it down if you need to find that pelvic plexus area. So that would be right here. And one other note, so this is levator ani, and coccygeus can also be seen, and I'll just flip this over and point it out on the lateral side, that coccygeus can also be seen on the lateral side. So this is coccygeus right here as well. So don't get confused. You can see it from both sides, but coccygeus here. All right, we're in the home stretch. So we'll have these last few terms are the extensions of the peritoneal cavity. So there's a picture in your book that's a pretty good diagram. It's 4-41, This is a female, this dog right here, but that is a picture of a male, so it doesn't have one of these extensions, but I'll try and show you as best I can. So here would be the descending colon, and so the rectum would be where you're entering here in the pelvis. And so you have this this pararectal fossa. This one's not a pouch, this one's a fossa. Pararectal fossa. So where the forceps are, between the body wall, the spine, and the rectum would be pararectal fossa. Okay, and then if we move down to the next one, so we go between the rectum and the genitalia, so here we have a uterus. And so that is the rectogenital pouch. So where the forceps are is rectogenital pouch. And in the females, you have an extra one. So here we go between the genitalia and the bladder, which is this little ball right here. And so that will be the vesicogenital pouch. So males don't have that one, but vesicogenital, so vesico meaning bladder. So in between those two, vesicogenital pouch. And then the last one will be between the bladder and the pelvis here. And so that is the pubovesical pouch, where the forceps are. Pubovesical pouch. And that should be it for Lab 18.